Hello, everyone, and thank you for coming to this presentation. My name is Tori Fleming, and today I'm going to be talking about caregiving for individuals with intellectual and developmental disabilities, or IDD, and age-related conditions such as dementia. Within this presentation, I'll share findings from a recent study that compared service utilization amongst caregivers of adults with IDD, dementia, and other conditions. Before I begin, I want to note that this was the work of Kristen Litzelman and me, Tori Fleming, with the University of Wisconsin-Madison on the Division of Extension. Now I will go over some research about service use amongst caregivers of aging adults with IDD. There is approximately 6.5 million adults with IDD living in the United States, and of that 6.5 million, about 850,600 of those adults with IDD are over 60 years old. And this number is also expected to increase up to 1.4 million by 2030. Adults with IDD are living longer due to medical advancements. However, as these individuals begin to age, they become more at risk for developing age-related conditions. These include dementia, epilepsy, heart disease and other cardiovascular conditions, obesity, diabetes, and musculoskeletal problems. With the increase in aging, adults with IDD tend to have poorer health outcomes and experience these age-related chronic conditions earlier than the general population. Unfortunately, family caregivers are not using services that may help alleviate their burden. Specifically, caregivers from minority groups are not using as many services as white European American caregivers. Also, caregivers of those with dementia are not using supportive services such as respite care, adult day programs, and employment leave policies, while caregivers of aging adults with IDD are not using services because many services either focus on aging or IDD and not the co-occurring of both. However, there is limited research around why caregivers are not using these proper services. We can assess service use across several dimensions seen here. From Penchansky and Thomas, we have the 5 A's, which are availability, accessibility, accommodation, affordability, and acceptability. Sauerman brought up a great point in their article that awareness also needs to be considered, as there has been some really great research on how awareness of services is important. Some reported reasons for not using services amongst caregivers is lack of information, time and geographical restraints, long wait lists, affordability, and lack of transportation. It should also be noted that caregivers of adults with IDD also experience a drop in services when the individual is considered an adult, which adds increased burden for finding, coordinating, and financing services. Within Wisconsin and other states, the most frequently reported services include state Medicaid units, aging agencies on aging, aging and disability resource centers, state units on aging, and centers for independent living. These services are super useful in providing information and access to support such as home health care, respite, educational programs, financial supports, and much more. There are also great local community-based resources such as community centers and advocacy organizations that assist families in finding support and resources within the community. The overall purpose of this presentation and the paper are to understand the use and barriers of services and caregivers of aging adults with IDD. So now I can transition into the results of our manuscript. When we compared caregivers of those with IDD to those caring for individuals with IDD, we found they contacted a similar number of agencies and used a similar number of services. However, when we compared caregivers of those with dementia to those caring for individuals without dementia, we found they contacted almost twice as many agencies and reported using services more frequently. We also ran an exploratory analysis on caregivers of those with both IDD and dementia and found they contacted twice as many agencies as adults with other conditions. But it should be noted that these caregivers of individuals with both conditions looked very similar to dementia caregivers overall. We also looked at reasons reported for not using services amongst these groups. And for individuals with IDD, nearly half reported not using services because they were unavailable. and around 1 in 4 caregivers of individuals with IDD also reported not using services because they did not meet their needs. And as for caregivers of those with dementia, almost half reported not using services due to the fact that they were not eligible or did not qualify. On this slide, we broke down a few reasons reported for not using services. As we already talked about, unavailability was high in the IDD group, and not being eligible was high in the dementia group. And here's a report for services not meeting the needs. About 30% across all groups reported phone calls leading to dead ends, and a good size report of caregivers reported not using services because they felt too overwhelmed to start or they were too time consuming. And lastly, a few caregivers reported not using services because of long wait lists. So now we'll talk a little bit about some implications from these findings. First and foremost, we want to talk about the gaps in service use. Within our findings, availability and eligibility were identified as key reasons for not using services. There also seems to be a misalignment between needs and resources in caregivers of adults with IDD. Because of this, these caregivers are not receiving adequate or appropriate services, nor are they accessing care for the care recipient. This misalignment could be due to the fact that services are designed and operated for aging or disability and not the co-occurring of aging and disability. Also, there is a workforce shortage beyond the pandemic of respite care workers. Therefore, the services may not be meeting the needs of caregivers to the extent they are needed. As for implications around policy and practice, it's important that we first become aware of this mismatch in order to fully assess the impact it has on the caregiver and care recipient. As we've seen, availability and eligibility are key concerns in our sample. With more information around these, we can determine ways to overcome this resource barrier. We also need to expand service availability and access. With policy, we can advocate for expanding services through state insurance. With the expansion in state insurance, individuals who were once ineligible may have the ability to receive these services. And secondly, we need to consider strategies to provide funding for services in order to support the well-being of families facing challenges. These include family care assessments that target resources that are needed most by caregivers, and also investing in ADRCs and other services can help caregivers reach support. And within practice, we need to have community-based research and translation initiatives to develop and access strategies for making resources available to accommodate the needs of caregivers, which could also increase caregivers' awareness of services within their community. And lastly, I just want to say thank you all for being here and listening to this presentation. And I also want to thank all the caregivers who participated in the survey, the Wisconsin Family and Caregiver Support Alliance, as well as Dr. Litzelman for mentoring me through this research project. And below is our contact information for if you have any questions or feedback. Thank you.